Hello and welcome. Today we will be discussing thyroid eye disease, or TED as it is commonly referred as, with Dr. Raymond Douglas, a world-leading clinician and thought leader in this rare disease. Thyroid eye disease is a rare autoimmune disorder that can dramatically impact a person's vision. The condition often occurs in people with hyperthyroidism or Graves' disease. Common symptoms can include upper eyelid retraction, dry eyes, inflammation, light sensitivity, as well as the sensation of a foreign body present in the eye. In this podcast, Dr. Douglas will provide an overview of thyroid eye disease, including diagnosis challenges and treatment options. Welcome, Dr. Douglas. Please introduce yourself and tell us about your work in thyroid eye disease.
I'm Raymond Douglas, and I have a practice in Beverly Hills, California, and been working in thyroid eye disease now for about 20 years as the primary aim of my practice and of my research. And so been working on both the basic science of thyroid eye disease, and some of those findings have led to the introduction of new medication and new therapies, primarily targeting the IGF-1 receptor therapies for patients with thyroid eye disease. And we've run, been the lead investigation crew for most of the clinical trials that led to the approval of teprotumumab, and continue to work with others to further care for thyroid eye disease patients.
Provide an overview of thyroid eye disease and how patients are typically diagnosed.
One of the real problems with thyroid eye disease is that it's so diverse, so heterogeneous amongst patients. Some patients get it very young, and I've had some patients get it when they're 80. Typically, patients will get it in middle age, in the 40s, 50s, 60s. But, look, it can occur at any time. It is usually preceded by Graves' disease, an autoimmune attack on the thyroid. And that has implications because there's two receptors that the immune system attacks. One is on the thyroid, and one is primarily on the eyes. And when the immune system attacks the eyes, it causes inflammation and tissue expansion. And for some patients, they just get bulgy eyes and not a lot of inflammation. And in other patients, they get tons of inflammation and maybe not as much bulging, or they can get double vision. So really anything that causes tissue expansion, bulging, inflammation around the eyes with Graves' disease has to really be thought of and investigated for thyroid eye disease. Yeah, the patient journey to diagnosis can often be rather complicated because, as you can imagine, patients are often being treated or having symptoms due to thyroid malfunction. And that's, really difficult for them to deal with because they might be hyperthyroid or their thyroid is too active or low. But then they start to get eye problems, and it's often misdiagnosed as allergies or as other things like that are non-specific. And so they'll often go from provider to provider looking for care and trying to find care before they really get a diagnosis. And this is on average has been about over a year before they sometimes can get diagnosed with thyroid eye disease. The biggest clue is often if someone has a thyroid abnormality, and that can be both Graves' disease or Hashimoto's, and then add in any kind of eye difficulty, whether that be, redness that doesn't go away, bulging, or a little bit of a stare, something like that. That combination is a big tip-off. But it's very common for patients to say, my eyes look different. I have this stare. I have this chronic inflammation. And so that really out of itself is a huge tip off that, hey, maybe this isn't allergy. It's been around for a month. It's not going away. Then you really have to dive a little bit deeper, and you can dive a little bit deeper just by doing some thyroid testing, and some other, a little bit of a history of patients, and really kind of get to that diagnosis fairly quickly.
How are patients with thyroid eye disease managed?
So current management is primarily medical, and then in some late stage cases, surgical. So that really has changed in the last 5 years. Before, very few patients were managed medically because medication didn't reverse the disease. But now that we have therapies that can actually reverse the disease, not just hold it steady, but actually reverse many of the findings, reverse the bulging, reverse the inflammation that's occurring here, then that becomes something that has really taken off. Still, there are patients that elect for surgery, and surgery is certainly very reasonable, and that's indicated to try just to overcome some of the appearance issues, some of the if there's any impingement on the optic nerve, things like that, to make more room behind the eye. It doesn't reverse the disease; it just kind of helps with the symptoms.
What are some of the treatments available?
You know, a milestone in the treatment of thyroid eye disease occurred in 2020 with the introduction of teprotumumab, and that was the first, indication of a medication by the FDA for treatment of thyroid eye disease. And now there is a whole host of medications that in the next few years will either work on the IGF-1 receptor or other receptors associated in this disease pathogenesis. So it's really a great time into thinking about the emergence of therapies. And in such, there will also be potentially oral therapies and therapies that are easy for patients to get. And if they have a reactivation, also easy for any kind of future treatments for them. It's very exciting. So the immune system attacks the IGF-1 receptor. And teprotumumab was innovative in that it blocks that receptor and blocks the activation. So it kind of turns down the thermostat of these cells. Sling Therapeutics is now coming out with a molecule that's an oral therapy, and it's a small molecule. So instead of having to get an IV, you could actually take this as a pill. And it's a small molecule that does exactly the same thing, and it's targeted to this receptor to stop its activation. And so it's very exciting that, there will be options for patients, hopefully in the relatively near future. So the FDA was very clear in telling us how trials should be conducted and moved forward for treatment of thyroid eye disease. And so the trial for Sling is also in a similar vein in that it's treatment of reversal of the eye bulging that's due to thyroid eye disease. And this is primarily in patients with active thyroid eye disease, and they're given a treatment with an oral medication. And 24 weeks later, look for improvement of that disease, meaning improvement of the eye bulging, and then other endpoints such as double vision, et cetera. And that trial is underway in over 20 centers around the world, garnering exceptional enthusiasm, and hopefully in the next several months come to some conclusion in moving that phase forward. So the timeline of the trial is it's currently enrolling patients. And with trials, it's always, a matter of when enough patients are enrolled to meet the enrollment criteria. And hopefully that, will happen in the next few months. But, so there is opportunity for patients still to enroll in these local centers for this trial. And this will be the first of two trials that are needed by the FDA. So there will be a follow-up trial, after this as a confirmatory if testing is positive.
Why do patients typically seek out treatments?
Well, I think the biggest thing for patients is that they have to understand that a lot of patients feel guilty about seeking treatment, feel that it's just a cosmetic disease, and it's really not. It impacts so many aspects of daily life. Patients just 80% of patients are less willing to go outside, go do things, go out, even enjoy a sunny day because their eyes hurt or they feel self-conscious. So the first thing is overcoming the stigma or the guilt of seeking treatment. And in the past we didn't have any treatments. But now there are really innovative treatments coming along that have very low side effects. And so it's really a time for patients to bring this to the attention of their physicians and let them know that they'd at least like to explore or hear more about these treatment options.